Machicote is the Chief Diversity Officer at the company called Premier. Premier is, they are a consortium of healthcare institutions, hospitals. They've got about 4,400 units throughout the United States. But that gives them the ability to leverage their collection to achieve better pricing. And they do it across a number of supply chain parts. Joe is one heck of an interesting guy. I did not know this man until he spoke at the Medicist Executive Luncheon. And Joe was actually, we had a problem. The speaker that we thought was going to be there had a health issue or conflict. Joe stepped up at literally the last minute, came in and delivered 20 minutes worth of remarks that will resonate with me for the rest of my life, quite frankly. And you're talking about a guy who can't remember what I did yesterday, but what he said at that meeting was really, really pivotal. He talked about humans being human, bringing your humanity to everything, leaving things, that just life lessons, leaving things better than when you found them. And these are messages that will resonate and should resonate with us as Rotarians forever. He's been involved in a number of industries, working in the diversity and healthcare space. And he's just one of the most uplifting, positive people I've ever met. I love this guy because he has a love for his mother, and truly, that means a lot to me. He mentioned his mom several times in his remarks at the Medicist Luncheon. And he's a very humble guy, a very self-effacing guy, but a guy who leads with his heart. And it's my pleasure and honor. I didn't even invite him here today. I was going to invite Joe to be a speaker, but Daryl beat me to it. Daryl actually invited him. So I was like, dude, what are you doing? It's stealing my thunder. But anyway, I'm just so humbled and honored to have Joe Machicote here. Joe, thank you for not just being here today, but for all you do every single day in this community.
Thank you. Thank you. I really appreciate that. And thank you. I'm humbled and honored to be here today to speak with all of you. And Kevin, you're absolutely right. Number one, I was honored to be in the audience as Kevin was being honored. And I'm like, oh my gosh, I got to get to know this guy. This is amazing. All of the things that he does. And then the more I found out, just the more amazed I was. And then to your point, Daryl jumped in front of you, tackled me, and said, can you speak to the Rotary Club? And I was like, sure, I can do that. He goes, by the way, Kevin's there too. I was like, yes, all right, I'm in, this is good. Well, to your point, and thank you so much, that was a lovely introduction. I've been around for a long time in the human resources space. I like to say I'm a recovering chief HR officer because in 2020, I made the decision to stop doing the CHRO role, which is Chief Human Resources, and I was always the dual person. I did HR and the diversity piece at the same time. So I've worked for a number of companies here in Charlotte. You've probably heard of Compass Group or Lance Snacks, which became Snyder's of Hanover and Lance Snacks. Worked for them here in Charlotte. Then I took a 6-year trip up to Baltimore and loved it. I was working for Erickson Senior Living in the healthcare space. And after 6 years in Baltimore, I said, you know what, I really miss Charlotte. I need to come back home. So 2 years ago, I decided to come back home. But in 2020, I made a very specific decision to go back into DEI. And number one, what was going on in our country and going on in our space. But Kevin, to your point, what I talked about was this bifurcation of ideology. Instead of thinking of ourselves as the human race and really taking a focus on humanity, we've gone into these two different camps, and both of those camps just think that they're right. And it's beginning to affect our behavior in a number of different things. And one of my attractions to the Rotary Club is what you guys do on a regular basis is in the spirit of, I don't care who you are, I don't care what you think, I don't care what you believe. I do care about how we all behave, and that behavior should be to support and make sure that the human race continues to thrive. So even just hearing the list that you gave of all the things that you guys are doing. I am highly energized. I've heard of the Rotary Club today, but today I'm in the midst of an education as well. So when I do a lot of these speaking engagements, I love the fact that I am educated. I try to share some of my knowledge, but I'm also trying to learn it too. So thank you to those of you I've sat and learned about just your spirit and the things that you do. So today, I'm going to talk to you a little bit about what's going on in healthcare. And you know, in 2020, we saw significant changes, not just in society, but when COVID hit. And it was something that we weren't prepared for at all in so many different ways. Even the way that we manage it from a healthcare point of view. But as humanity, we weren't ready for something like that. We had not seen a global pandemic that was that crushing to us in a super, super long time. So how it affects the way we do things in healthcare has significantly changed. I put up just a couple of things here on the slide about Premier, you know, kind of who we are. We support 4,400 hospitals. We call ourselves a healthcare improvement company. So we're really consultants, scientists. We manage data for hospitals. We share the data back with hospitals so the doctors can make good decisions about things, whether it's cancer, it's maternal health, all of the information from folks that come out of the hospital. You know, once they leave, some of that information just kind of goes into the ether. So when you're in the hospital, we can collect all the information we need on you, but 90% of healthcare actually takes place outside the hospital. So then how do we take that information and put it together so that, you know, I can say, hey, Alan, we know you were in the hospital, but here's been your journey, and now we're going to connect all of that information together. Matter of fact, in New York City, what we just did is we were able to look at all of the CAT scans. There was about 175,000 CAT scans that were taken during COVID, because doctors wanted to know what COVID is doing to your body and how can we help you to survive. So they took all of these CAT scans, but what the doctors missed in the CAT scans was that there was the possibility of these nodules forming that were causing lung cancer. And by putting all of the information together, after folks had left the hospital, we were able to find, we thought we were going to find about 5,000 incidents of people who had these, predetermining nodules for cancer. We found 27,000.
Wow.
And that changed the lives of 27,000 New Yorkers, because now doctors have the information they need to go back to these people and say, come back in. We see something we don't like, and now we need to be able to provide a cure for it. Interestingly enough, my brother was one of those people, and 6 weeks ago announced to us that he's got lung. So we're doing some pretty incredible work. We also manage group purchasing volume, about $69 billion across the country of purchasing volume, and like I said, we have data on information from 45% of all the hospital discharges in the country. So we do this through supply chain, population health, pharmacy, finance and operations, quality improvement, and data and analytics. But one of the big things for us that we're trying to work on is get hospitals to be better at advancing health equity. And when we say health equity, a lot of times when we hear diversity, we think that that is, you know, like a function that is only out there to support minority groups. And that is not exactly true. Diversity is about making sure that people are getting fair and equitable chances to experience the same things that each other experience. And sometimes those privileges are earned and sometimes they're unearned. But how do we get people to a place of equity where they can earn those same positive advantages? So that's what we talk about in health equity. And sometimes when I think about our rural brothers and sisters in the middle of the country, that, you know, they may be on a farm, but getting to a hospital for them could be a 60 to 75-minute drive. Whereas someone that lives in the city, the hospital may be just down the street. So how do we prepare those hospital situations to provide health equity in those communities where people can get healthcare, they can get the access to healthcare a lot faster? So it's truly, you know, race and all of those other things are conversations that we should have, but it's more about how do we solve for humanity first? How are we making sure that people are getting the things that they need? So the way that we do that is by making sure we're engaging our heads and our hearts into action. And I'm preaching to the choir here, I totally get that, but I just wanted to give you a different perspective because I know that you've got a mental health speaker that's coming up. By the way, I am the incoming president of 2024 of Mental Health America of the Central Carolinas. So this is something that's also really, really powerful to me. And I would love to come back and chat with you on what you're doing around mental health as well. So I broke this into 3 different things, right? So how do we start with our head? So what are the facts and what do you need to know? So number 1, we need to understand that health equity means that everyone has a fair opportunity to be healthy. Duh, right? It's in the words. Health equity, health disparities, and social determinants of health. So there are many different social determinants of health. The accent that you're hearing, I was born and raised in Harlem, New York City. And in New York City, back in the 60s, when I was born, literally you could look at health and you could define it by zip code, how healthy you were going to be, based on the neighborhood that you were coming out of. So there's social determinants that are implied in our ability to get health equity, make health an equitable issue for each individual. How unconscious and implicit bias and discrimination impact SDOHs. Now, when you think of discrimination, you think about people not, being evil to one another. And that's not what I'm talking about. What we're talking about is discrimination in the data. So historically, people of minority backgrounds, they don't necessarily trust healthcare systems. So when they're going into healthcare, there's not enough information, historical information on them to make good decisions about the future. So for instance, in the African American community, hypertension is something that's really, really big. Now that doesn't mean that it's not big everywhere else, but for some reason, that percentage of the population suffers that disease even more often. But if there's not enough people going into the hospital, you never collect the data. So what winds up happening is you get discrimination in the data, not discrimination against one another, you get discrimination in the data. So we also need to understand how cultural sensitivity and respect help to solve for these social determinants of health. So if I have someone that doesn't trust the health system, we've got to teach doctors how to be a little bit more patient, excuse the pun, but a little more patient with their patients in receiving the data, because they may be coming from a place of distrust. And 90% of all healthcare takes place outside the hospital. So this is a very busy slide, but just wanted to give you a flavor. There's hundreds of social determinants of health. For each one of us sitting in this room, we may have particular social determinants that as an individual may make you have a different outcome, even though you may have the same illness or disease. But these are the ones that impact the most: economic stability, education access and quality, health access and quality, natural and built environment, and social and community context. So we find that there's more things like asthma and things like that in cities, because believe it or not, there's not enough oxygen being created in the cities. This is primarily asphalt. Whereas you go out into the country and you see people that don't suffer from allergies, asthma, and other respiratory diseases as people that are in the city. So even the environment has an impact on who we are and our livelihood and our health. It's also really important to know the difference between equality, equity, and what we call justice. So equality, you can see here, there's 3 people of different heights, and everybody gets something, right? Everybody gets a box to stand on to see over the fence. But we can see that even though this individual got a box, maybe they can't see over the fence. Equity is about saying, well, let's give people what they need when they need it. So the story I usually tell is I have 4 children, and the last one is the baby girl, and she knows it, and she utilizes it, and she leverages it against us on a regular basis. She is the baby. They're all in their 20s and 30s, and they've all moved out of the house. But the story I give is that if all 4 kids were outside playing, and Liana falls and scrapes her knee, does that mean, and she's crying, sitting on the floor, and the boys are off having a good time, Does that mean that I call all 4 kids in and say, hey, Liana's straight for me, so everybody needs a Band-Aid? Or do I focus on Liana right now because she's the one in the most pain? It doesn't mean I don't love the 3 boys. It just means I gotta focus on Liana in this moment. That's what equity is about. It doesn't mean that I have to give to others, give to others, give to others, and ignore you. It just means these are the people in the most need right now. And you guys, I'm sure, do it on a regular basis. People come in all the time and ask for your help and assistance. And I'm sure that you have to prioritize where that assistance is going to come. So you are practicing equity, and sometimes we don't even realize that. But if you notice here, there's a fence, right? So equity is about getting everybody to be able to see over the fence. But what if we remove the barriers completely? Then we don't even have to focus on necessarily that. Just how do we remove the barriers to healthcare? And there's different ways that we're focusing on trying to do that. So like I said, the list is long of all the different social determinants, but it could be age, it could be gender, it could be sexual orientation, it could be maternal and infant health, something that is really important to us. Matter of fact, we work with HHS. We have HHS contract in the United States for trying to solve these maternal and health issues. The American healthcare is number 18 in the world for maternal health. And you're thinking, what? How is that even possible? But the death rate in the United States is higher than most countries to the point where we rank 18. That's absolutely incredible to hear. The urban and rural zip codes, they matter. Language, nationality, healthcare labor shortages, supply shortages, etc. By the way, all of you have probably learned about supply chain at this point, right? 5 years ago, nobody knew what supply chain was. We thought Charmin shows up on the shelves of our supermarket by some, little magic elves that bring Charmin toilet paper and put it out there. Now everybody is worried about supply chain, and that was something else that came out of COVID. In the healthcare area, it's something that we're really, really struggling with. And the fact that we have so much going on worldwide, our relationships with China and so on, so much medical equipment and medical products come out of China. And it's so important for us to be able to say, look, if that relationship is rocky, what do we do in America to make sure that we're producing here so that if we run into another pandemic like this one, we're well prepared. So that's kind of the stuff you need to know from healthcare. So what are the things you need to embrace? And this is the part where I'm preaching to the choir. Well, number one, we have to start earning back trust in healthcare. So having people from our community actually add to the healthcare environment is really important. All of you have such the ability to connect with the communities that you work with because they trust you, to be able to be an extension of the hospitals, the doctors, the nurses, the scientists that are trying to help us. Trust is all about 2 things, what you say and what you do, right? For all of us, that is the formula. When we trust somebody, it's because they do the things they say they're going to do, and they do the things they say. And if those 2 things are not in alignment, we don't trust them. And historically, healthcare in the United States, there has been this distrust, especially in the minoritized communities. There's been a big distrust with healthcare. So we've got to get back to doing what we say we're going to do. Because I can't believe what you say because I see what you do. It's a very, very powerful quote. The next thing that we have to be able to own is our stuff, and understanding that you have the most incredible power in the universe, and that is the ability to hurt or heal others with your words and actions. Right? And it's really interesting. I mean, we've all been hurt by someone we love, or someone that said something that was evil or mean to us, and they apologize, but it's hard to take words back, right? Maybe you can't remember what they said, but we always remember how we feel in that particular moment. So how do we own our behaviors and our actions on a regular basis? Your own personal behavior is the only thing in the world that you're in charge of in this universe. And here at the Rotary, you guys have taken your behavior and put it into action. That's what the trust is all about. You're saying what you do, you're doing what you say. And it's absolutely brilliant to watch. I'm very inspired to this, being around all of this. This is my personal mantra. You know, I believe that they won't see what you see until you see what they see. And the way that I show up every single day, the morning mantra that I say to myself every single day is I'm going to read everything and everyone a little bit better than I found it. Now, that was something I learned from my mom. To Kevin's point, my mom is my hero, and I've learned many lessons from her that I carry throughout my life. And she, when I was little, she said, my name was Joey back then, she said, Joey, you got to make sure you read everything better than you found it. And I think she meant, you know, pushing the chair in when I got up, taking my plate to the sink, putting the toilet seat down when I'm done. But I've taken it a little bit farther. How do I leave everything and everyone a little bit better than I found it? And when you begin with a mantra like that, everything that you do, everything that you say through that lens becomes and sounds a little bit different. So I can have a difficult conversation with an individual and make them feel like the most important person in the world. And also make them feel like I'm on their side. And being in HR, I have conversations like that all the time. I have to talk about performance. I have to talk about how, you know, people interact with one another. And when people leave my office, my goal is for people to say, Joe, thank you so much for that feedback. I can be a better person because of you. So that's my lifelong goal. So all of you live by that mantra and you don't even realize that you do. So for me, watching humanity be very intentional about that is really key. So this is how I own my own actions every single day. These are questions that I ask myself. Who am I being in each and every situation? How do others experience me? What do I leave in my wake? What do I intentionally create? And what do I unintentionally create? And do I have a plan for how I want to be experienced by others? Now, I practice this at work, but more importantly, I practice this at home with my wife. I make sure that this is, that our relationship is a strong relationship where she can tell me when I'm not being experienced the way I want to be experienced. And I am human, so I reserve the right to get it wrong and just mess it up sometimes. And I want her to let me know when I do this. And we do this for each other. And I think that it strengthens our relationship in a big way. Another piece is to make sure that we know that we're owning our personal privilege. Again, this is the hard stuff. You know, when typically someone says privilege, we think that there's some sort of financial definition to the word privilege. It's not. I find myself very privileged. I think before I was even in this position, growing up in Harlem in the projects, I found myself very privileged because I had access to things that some other people did not. And I look back at Harlem now, and I look back at some friends, and I look at family, and I just thank my higher power for how privileged I am. So privilege is about the presence of earned or unearned positive advantages. It's whether or not you accept it or know it, you may be privileged. We have to learn to share our privilege with those who don't share the same advantages. And are you aware and understand your privilege in relation to others? So let me give you an example. A long time ago when I was working for Compass Group, I was traveling globally. And through my air miles and everything else, thus this picture, when I used to travel to Europe, it got to a point where that was the kind of seat that I would be in, traveling to Europe. And while this was happening, there was a little conflict going on, known as Desert Storm. And living here in North Carolina, what do you see a lot of especially while we're in the midst of military action? You see a lot of military individuals. So sometimes when I was traveling, if I saw one of our service people that was kind of by themselves or whatever, number one, I would sit and want to have a conversation with them, thank them for their service. And as I got to know them, I would say, hey, by the way, what seat are you in? And they say, oh yeah, this is my ticket, sitting in coach. And I would say, well, this is my ticket. I'm sitting in first class. How about we swap tickets? I just want to thank you for your service. Now, that's a privilege. I got this privilege from taking airline miles. Sharing your privilege is about being able to take that earned or unearned positive advantage, whatever it is, and sharing it with one another. The way that you do it at the Rotary Club is your time, your talent, your treasure. By the way, I put a little bit of money here in the happy bucket. My happy is getting to spend some time with you today, so I just want to
Hey, Joe, before you go on,
Yeah.
you share with us, you did an example that has with parking.
Oh, yes.
And
Yes.
that was just so, when you're talking about privilege,
Yes.
this, what he did there was.
Okay, so, we all have had the opportunity to park and come out of a building kind of late at night when it's kind of dark, right? So, ladies, would you like to explain what the process is? And you can all talk at once. What is the process for you going to your car late at night in a dark parking lot? Go.
Watch around.
Fear,
You wear everything.
you can use in your hand, keys out.
Yeah.
In a way that you can stab somebody if you need to.
Yeah, okay. Gentlemen, what is our process for going to a car?
Walk in the car and open it up.
That's it. We hardly even think about it, right? Depending on the neighborhood, we might think about it for a flash of a second. But for a woman, it's very, very different. So for me, when that would happen when I was working in my offices, we'd be there late at night, the first thing I would do is walk around the office and see who was left. And you know, there's strength in numbers. So number one, let's all leave together. And sometimes I would ask one of my female associates and they'd say, yeah, you know, I'm getting ready to leave in 10 minutes. They're like, you know what, I'm gonna wait with you. I'm gonna hang out with you. Now, that is not a privilege that, gentlemen, we didn't earn that privilege. We just happen to be born with that chromosome, right? We have a chromosome that says, thou shalt not be worried about walking in a parking lot, right? We didn't earn that. It's an unearned positive advantage in that particular situation. So how do we take our privilege then and share it? Is for me to go to my colleague and say, would you like to be, you know, would you like to walk together to our park at night? Just to reduce, you know, not because, you know, it makes males better than females or whatever. This is a particular situation. And what it's about is being able to share that.
One of the things we do in the banking industry, when we close, we have a specific opening process and we have a specific closing process. And the closing process, we leave together. You don't walk out separately. If the doors are locked, you wait until everybody's ready to go.
Yep.
If the doors are unlocked, you can still come and go, but once the door's locked, you leave in groups.
Yeah, right? And that's it. That's about sharing the privilege of being able to be together. And the last thing in our hearts is about being curious, not judgmental. You know, as human beings, you know, when you meet an individual, you size them up, right? They're tall, short, male, female, we size them up. And we have every right to do that because we're human beings. We observe things. It helps us with our surroundings. But what is not good is when we make judgments based on what we see. I've seen that before, so this must be the case right now. So being curious is about just learning, shaking a hand and finding out more. And suspending your assumptions about everything that you think that you learned before, anything that you have seen before, just suspending your assumptions about it. And starting with the fact that we are two humans shaking hands. Now let's learn some more. So what do we need to do? So now I've given you some facts about healthcare. I've given you some of the things, you know, kind of the head stuff, now the heart stuff. So now how do we put this into action? And this is my mom. And another favorite lesson from her is she used to say, if you want to get the whole neighborhood clean, start by sweeping in front of your own house. Right? So sometimes we can be very judgmental of the things that are around us, and meanwhile, our stuff don't look so good. So we need to be able to clean up our own stuff before we earn the right to go ahead and do that. So that's the first thing that we need to do is to be able to understand that. Second thing we need to do is to embrace transformational change. And change is a radical change from the past. It creates something that's never existed before, not just improvements to what already exists. So you all know this, but I don't know if you've heard it put this way, but 2019 is not coming back. Life has changed significantly for us. So now what we can't do is think about all the things that used to happen for us in 2019. We have to think about the things we're going to create in 2023 and beyond. Because we have lost those things in 2019. Can't go back. It's transformation. What has happened is created some new opportunities for us. Think a little bit differently. Like I said, hospitals right now, they're undergoing some major change. People aren't using hospitals like they did before. They're using external care to the point where we are now looking at maybe 97% of all healthcare is going to take place outside the hospital. It's absolutely incredible to watch. It requires transformers and us having a growth mindset, positive. And it requires a complete transition because there is no going back. And something that we like to practice is what we call appreciative leadership. It's a relational capacity to mobilize creative potential into positive power. So what you're doing is taking your potential and turning it into positive power to help others. And we start with renewing or bringing our experiences and our identities. You seem to do that on a regular basis. Creating relationships. I watched very intentionally the way each one of you read each other and you rib each other and you have a good time with one another. That creates family and it creates strength that people can't break. It's unbreakable. Co-create, envision this ideal future together, which is what I love, just hearing, and I'm hoping I'm saying your name right, Samarja?
Yes.
Yes, right? So what you're co-creating and envisioning that ideal future together, just by talking what you're gonna do over the next couple of weeks and months is so critical. Build on what's working, and create solutions that emerge from our collaboration and everyone's contributions. And then finally, we get to what we call resolve, where we identify and take heartfelt actions, connecting our head and heart in this work. And the actions are a combination of personal commitment and social organizational solutions. So I want to leave you with this. This is your action plan. So, and you've already started down the path just by hearing what you're going to do in the next couple of months. Make health equity an explicit and active commitment. It's so important. Everything starts with health, and we all know this. Everything starts with health. But health has so many other dependent pieces and so many other social determinants that create good health. Build personal awareness, knowledge, skills, and tools to advance health equity. Support organizations closing the gap in health equity with your time, talent, and treasure. And drive action by supporting data, research, dissemination, and responsible communication. Because there's a lot of stuff out there that's not necessarily always the truth. We've got to focus on data and how we go about just being good to our community. So again, I feel like I have, I'm preaching to the choir, but I want to thank each and every one of you for inviting me and so warmly welcoming me today. Jenny has already said to me, you could join us. She's already doing the recruiting right here. And it's, I'm thinking about it. Gotta make sure I got my time because I'm gonna commit, Yes.
Your last point there about the supporting data, drive action by supporting data, research, dissemination, and responsible communication. Does Premium have publicly available information? You guys have such a collaboration of participants in your organization. It seems like you would have some wonderful data that Rotary could access to help drive some of our decisions.
So we do. We are the primary supplier. We don't put it out as Premier because the information. And so, one of the things, Jenny, you had told me bring a thumb drive with your. So I plugged the thumb drive into my computer and I got this message pop up that, our company does not allow you to download information on a thumb drive.
Oh.
And part of it is because we have so much medical information. But where you will see our research is through the CDC, Most of the larger, the Health and Hospitals Corporation, the American Hospital Association, all of the data that you see produced through all of these healthcare outlets is actually coming from.
Okay.
So we don't go out there as Premier. We have to handle the information in such a way that we put it into these responsible hands, and then they produce it. So when you're reading articles on a lot of medical, whether it's the New York Times or the Wall Street Journal and so on, every now and then you see Premier quote it. But the one thing I didn't talk about is we have advocacy on the Hill in DC. So we work with the House Ways and Means Commission, and that's a bipartisan group that's working on healthcare, and we enact legislature that way. So we have a team in DC that does nothing but sit right on the Hill. They're literally a block from the Senate. They're feeling good right now because Senate is out. So are we. Everybody takes a breath, but they'll be back in September, and we go hard again with some of this stuff. So you'll see our stuff in that way.
You talked about 97% of healthcare is outside the hospital. That's sort of hard to fathom here in Charlotte when we're watching hospitals by medical practices, by nursing homes, by whatever, and expand their reach hugely.
Yeah.
Can you speak to that?
Sure.
Where is the 90? Is it mom putting a Band-Aid on? Is outside of healthcare? What?
No. So, and when I say outside of the hospital, I'm talking about the four walls of the hospital. So it used to be, when back in the 60s and so on, when something was going on, whether it was surgery or something else, we went to the hospital, and that was the central location. Now you're seeing back and spine centers. You're seeing, especially for the elderly, you're seeing all of these different levels of senior living. So that's what I mean by just health, the whole world of healthcare, even radiology and things like that is now taking place outside. You go to a radiology center as opposed to being within the four walls of the hospital. So that's
Owned by the hospital, but not the
it's
actual-
owned by the hospital, but not.
A separate facility.
So isn't that sort of when I think of that, I think that's hospital.
Yeah.
It's got the overview.
What would the figure be if you included all of those hospital-owned entities? It has to be hugely worked.
Yeah, I mean, if you considered all of that hospital, it's still not a huge number. You're probably thinking 60-ish%. Because there's so many different, whether it's even a different doctors that are running their own offices and things like that. It's probably about 60%.
Well, I think especially as you get out into the rural areas, I talked to my counterpart in 7670. One of the things that's one of the things I love about medicine is because so many people out there are so dispersed, they never go to a hospital.
Yeah.
That's the beauty of something like medicine that has a mail order pharmacy program.
Right.
Those folks are, like you said, 60, 70 miles away, and there's a lot of them out there. And they just, they get to a hospital once a year.
Yeah.
It's
Or not at all. The insurance companies actually push you away from going to hospitals, especially things like the emergency room. Like when I was younger, if anything happened, we went to the emergency room.
Yep, right.
Insurance tells you do not go to emergency room, go to your primary care physician. And typically that primary care physician is off-site from the hospital. So part of the reason, that I use that number as a concern for us is because you've got these big brick and mortar hospitals that are losing money hand over fist just on the real estate alone. Because they're pushing their stuff to the outside, except for the atriums of the world, they're doing very good. Yeah, the large hospitals, in Charlotte, it's gonna be a little bit different conversation than say Kankakee, where we actually have a medical system out there. But the hospital itself is very small, everything takes place on the outskirts of the hospital. So it depends on where you go.
Support the rural hospitals that are in such dire straits.
Yeah, so number one, we support them with data, but we also support them with very new and innovative pieces. So mobile hospitals are becoming very popular, where especially in those rural areas, you have, and they're not necessarily always set up by the hospital, they could be set up by clinics and centers and the kind of the minute clinic type. But they will have a mobile unit that actually goes out and will take care of healthcare that way. So,
60
and
minutes.
that's what you begin to get.
60 Minutes did a wonderful piece a couple of years ago on a mobile unit in West Virginia. Actually, two ladies. And they drove all the areas of West Virginia.
Two nurses.
Yeah, two nurses. And most of their issues were related to drugs.
Yes.
So many people they were treating for.
Good thing West Virginia.
That's what I said, West Virginia.
Yeah, even addiction was something that was typically managed clinically. And now you have different centers, like here in Charlotte, we've got CCR.
Yep.
And a couple of other different centers that are taking place outside the hospital.
Do you have any idea of what health equity looks like in the eastern part of the state? We have large rural areas,
Mm-hmm.
and I understand some hospitals close
Yes.
for whatever reason.
Exactly, and that's part of it. They're losing money, but they're also losing labor. And they just don't have the labor to operate. So we're seeing health equity issues, to your point, in that rural eastern North Carolina. That's a hot spot right now for us, because some of the systems are closing. Atrium is trying to do some infill with that, which we're appreciative of, and Novant. They're also doing their part, but it's going to be slow and it's going to be long. But every day we're hearing about more and more hospitals close. They're just running out of money.
Joe, you talked about being able to predict health outcomes based on, you were talking, I think, zip codes. As we look at the bell and the curve here in Charlotte, I know UNCC's Urban Institute came out with this program that allowed you to look at areas and different outcomes, health, life expectancy being one of them, back in 2019, and the areas in that impacted area, which has historically been an underserved area from an health equity perspective, were consistently lower than other parts of Charlotte and Mecklenburg. And just wondering what efforts are being done, if you know of any that are being done to help improve the health outcomes for people that are in that area.
Yeah. And it's so interesting because each hospital or hospital system or just the healthcare network that's involved with each city, with each local rural area, we find different levels of health disparities that are taking place in each of those different areas. And it's really dependent. And that's why, when I talk about health equity, I like to talk about it from a very contextual level, because New York City's problems are going to be a whole lot different than, Cherry Point, North Carolina. Just from the access that they're able to have. They may be seeing more healthcare issues, but they have more access. And then in Cherry Point, they may not necessarily have as many of the healthcare issues, but they don't have the access. The problem is the access is going to cause more healthcare issues because people are not utilizing it the right way, or they don't even have the staff to actually utilize. And it's going to be an interesting next 10 years in healthcare.
I've experienced healthcare in 3 different countries,
Mm-hmm.
and I just feel like healthcare here there's a barrier. You can't, if you're feeling sick, you can't just go to a doctor
Yeah.
because you would never know where to go. One, you have to either go to the urgent care or the emergency.
Right.
There's no access directly to your doctor unless you have your insurance ready and all these forms to fill out. It's just the access. Mentally, I don't feel like going to the doctor.
Right.
And I'm from India. There it's very simple. You just show up at the clinic and the doctor will see you. You might wait for a little bit, but you get to see the doctor.
Mm-hmm.
In England, it was free and it was about the same way.
Right.
You can just go to a clinic and they'll see you. Here, even after making an appointment, you're still waiting for an hour to see your doctor. I think that's the barrier, that's your wall.
Yeah.
You know?
Yeah.
Where it might be the insurance or just the way it's set up, it's complicated.
We have overcomplicated healthcare.
It's very much.
There's no doubt about that. When you go to Canada, it's also a different experience.
Joe, do you work very closely with nonprofits like Machiote?
Yes, so we work with them from an information point of view. You know, we typically will have employees go and volunteer and we have a whole network from the diversity work that I do. We have employee resource groups that choose different community operations that they want to go out. And I can't wait to go back and tell them about you guys. So I don't know how your model works, but we'll have to talk offline about
Especially as it relates to.
how I get employees
visiting the
involved
elders.
and members.
Yeah.
You know, how you guys grow your members.
Yes.
49 is big, but I don't know if you're looking to grow bigger.
We are.
Yeah,
We love
I think it's a great opportunity.
love to have that conversation.
Yeah.
What did we used to have, David?
Julie?
How many members did we used to have?
150.
Oh, yeah.
Yeah, we would love to, even if it doesn't result in membership, just the service.
Yeah.
Being able to provide service, if we can leverage that, that would be fantastic.
Question,
Awesome. Yes.
if we had universal health care in the United States, what kind of a dent would it make in the healthcare equity issue?
I believe that it would make a huge dent. Our problem is that quite frankly, healthcare has been part of our capitalist society. So you have the insurance company. Matter of fact, in our world, we call it there's the payers, which is the insurance company, and then you have the payviders. And the payviders is when hospitals and other healthcare kind of units and businesses are actually providing what insurance companies used to do, which is actually becoming the payers. So until that system breaks or we do something about that system, it's going to be really hard to go to the universal healthcare model. Because you've got the Blue Cross Blue Shields, you've got all of these others that are making money off of this, and you've got employers that are self-insured.
So that keeps everybody from having health insurance.
Not necessarily from people from having health insurance, but health insurance sometimes gets in the way. And then you've got employers that are also standing in the way. If you're a self-insured company, you might say, look, I'm going to cover this, this, and this, but I'm not going to cover this. So that chases that person away from getting the type of healthcare that they need because it's just too expensive.
Yeah.
So universal can help because what it would do is bring down the expenses and it would level them out. But you're going to make a whole bunch of people very unexcited because you've got all of these different insurance companies that are publicly traded that are looking for their investors to make money. So it's a real hard double-edged sword. I don't know how we're going to break that system. Something's got to change.
Yes.